It's my hope we can come up with some therapeutics for this condition. One of the real barriers to that is seeing that we are able to launch more clinical trials. I want to get your update on how the clinical trials are going, what plans you might have in the works to increase the number of clinical trials as it pertains to long COVID.
Yeah, Senator, there was a project funded, a long COVID project at NIH. There was a huge amount of money spent on it. It yielded nothing.
I agree with that.
Right, and I think you know that we are doing now a different approach. We're launching a long COVID consortium. We're bringing together the best doctors in the country who have developed reputations for being able to treat long COVID. And one of them is a doctor that actually...
Dr. Bruce Patterson.
Yeah, Bruce Patterson, and then Dr. Jordan Vaughn, also from Florida. There's a number of them who are doing spectacular things where patients are reporting extraordinary progress. We want to get them all involved and all in one room. We want to identify the protocols that are working. This is something that did not happen during COVID. It was all ivory tower science, and the doctors who were on the ground were ignored. The same thing happened during the HIV crisis.
Yes.
And we're trying to do something different, which
So
is
my
really
time's limited. You mentioned ivory tower. And so that's a segue into a statistic that I've become familiar with over the years. It takes roughly 18 years for proven interventions, pharmacological or other types of medical interventions, to make their way out into the field. If we assume, I think a conservative estimate, 12 to 15 years until we have any really acceptable therapeutics for a long COVID, that's a cheerful estimate. Plus the 18 years until it finds its way into clinical practice, people roughly my age will pass. Actuarially speaking, they will pass before there's any acceptable therapeutic. So we need to accelerate our current activities. Can you give me a couple of